We have had amazing feedback from not just our volunteers, but also our beneficiaries of the program. Most of the times I'm inspired by the personal individual stories that we get when we move around asking people for feedback about the project. And one particular one that stands out for me is about a father in Kamayama in Lamli who was visited by one of our volunteers. And during the visit, he noticed that one of the children was not well, and he advised the father to take the child to hospital. And according to the father, when he took the child to the hospital, the doctor actually told him that had he waited a little longer, maybe the child wouldn't have made it. The child had complications of malaria, and the child was treated. When the father went back, he actually became an advocate of the program, never been trained by us, but because his daughter had been saved by this one volunteer, he became an advocate of the program. There are several other stories that I can recount. So many of them are about behavioral change. People now, you know, sleeping under bed nets, people cleaning their environment, you know, trying to clear their surroundings of all the breeding sites for mosquitoes. And for me, that is truly impact that the program is working. As a medical doctor trained in Uganda and working in Uganda, I had some little experience about working with faith leaders, but it was mainly in the area of HIV prevention, and this was mainly with church leaders. I'd never done any interfaith work before, so coming to Sierra Leone was more of like an adventure. I was coming now to try and see if this is actually something that is worth doing. And I have been blown away completely by what has been happening on the ground. I have never seen so many faith leaders in my life, met so many faith leaders in my life before, and actually having to see Christians and Muslims, a Muslim seated in church and a Christian going to a mosque. For the first time I went to a mosque because of this program. I have been able to understand what it actually means to be respectful of people's faith, having come from different backgrounds. And I have also learned that the enthusiasm of people who are in this project, the volunteers themselves, is what is actually driving the program ahead. Also harnessing the fact that there is a lot of support from the local leaders who also consider faith leaders as being a big force for projects like this. As I've already said, I was a clinician, purely clinician, and I had never really had practical experience with working with faith leaders in the community. And I think for me that is one of the most outstanding things, having to actually see interfaith work in its practical aspect, having to see a Muslim and a Christian go together to train volunteers and actually monitor them as they go house to house. That for me is very, very inspiring. But aside from that, I've also learned, having come from a very clinical background, that actually when you involve the community, people who are existing, people who have wide networks like faith leaders, your dollar actually does go very far, because you spend so few resources to get your message out to many people. I've always been a person who is a believer that when you educate people, whatever it is, whatever setting it is, you empower them to take charge of their health. And once they take charge of their health, they're then able to pass on those kind of messages to other people. And I think one of the things I'll take from here is to continue using existing networks like faith leaders who are in the community, who reach down to the community. Now I'll take that back to my country, and that will be something that will make the dollar actually go further.